Hey everybody, it's Dr. Dave Psychiatry. Thanks for coming to the YouTube channel today. I'm here again to remind you that if medicine fixes your problem, then that means it's medical, not mental. So today we're talking again about what I preach on this channel, which is that these conditions that get called mental health, once they respond to medication, they should be treated like diabetes or blood pressure or anything else. Why am I talking about that today? No sooner had I done my video on Adderall than I had a patient say to me, Dr. Holmes, my son had to go off his Adderall because of custody issues. I said, what are you talking about? And the woman described that her son, who was in a shared custody situation between his mother and father, the father disagreed with the medical treatment. And basically during the custody times that he's with that child, he doesn't let the child have the Adderall. Now, to me, this is just wrong. I know that divorce is very common in America, that families fall apart, they can't be reconstructed. When there are kids involved, parents are supposed to get along and try to raise those kids as best they can and to make mutually beneficial decisions. So I can't imagine two parents going to war and saying, well, my kid's got cancer, but I'm not letting him have the chemo when he's in my custody. Or my kid has diabetes, but I'm not letting him have his insulin while he's in my custody. So how can a legitimate parent, how can a good parent say something like, well, I'm not going to give the kid his medicine for his attention deficit disorder while he's in my custody? I don't care if you agree with it. I don't even care if you agree with it. That's not the issue. You don't have to agree to it. The issue is, does the child do better or not? So the evidence is in front of you. Now, if the grades are better, if the behaviors are better, if you see it around the household that he's better, and if you're honest about it, then the kid should remain on the medicine. Now, alternatively, if the medicine's not helping, if it's not the right thing, if it's causing side effects or causes issues, obviously the kid shouldn't be on medication. The core issue is that when people start to think that brain chemistry medicine is different than other medications for themselves, for their family, for their children, for their spouses, that causes problems because fundamentally it's not true. If you get better with the medication, that doesn't mean you're mentally ill. That means that you have a brain chemistry problem and the medicine fixes it. So as I talked about in my Adderall video, if your norepinephrine is low, if it should be here and it's here, and Adderall raises it, and you're more able to concentrate, more able to focus, more able to get things done, less distractions, more able to accomplish your tasks. If it fixes the problems that you're having, well, if medication fixes it, that makes it medical, not mental. That is the core issue of this channel. It's, as I talk about the top of the pyramid, that's the thing I should probably say every visit. Maybe I'll just start doing that. Anyhow, I don't know why lawyers get involved. I don't know why parents decide that they're going to go to war and make their kids be in the middle of it. It's tragic. It happens all the time. It doesn't do any good to anybody except maybe give the warring spouses the sense that they have control over the other spouse, which in some ways I consider abusive. I sort of consider that child abuse. And our society, if you told your kid that he couldn't get his insulin or his diabetes, a court wouldn't stand for that. If your kid had cancer and the warring spouse said, no, I'm letting him have chemo, the courts wouldn't stand for that. Why do the lawyers and the courts stand for it in these circumstances? I don't know. Is it easier just to roll over and say, fine, my kid doesn't get his medicine for the summertime? Yeah, it's probably easier. But I think everyone's at fault there. I think if the medicine's important, it needs to be fought for. And if the child benefits from it, I think the child should get it. So I don't know how many of you had children, how many of you this touches in terms of a story or relationships, but I think it's pretty important because I think it really speaks to how do we view medication in general. Do we view it as a crutch? Do we view it as a salve or a Band-Aid? Or do we look at brain chemistry medicines like Adderall or Ritalin or Zoloft or Prozac or Cymbalta or Xanax or Klonopin or Valium, any of the tools that I use on a daily basis to help people with their brain chemistry? Is that just sort of smoke and mirrors, or is that legitimate medicine? Did I go to medical school and did I study medicine to become a psychiatrist? Yes, I did. Was I a surgeon once? I was a surgical resident? Absolutely. Do I know about medical problems? Absolutely. Is this something that I believe in? Absolutely. Thanks for coming to the channel. Thanks for being with me today. And for those of you that subscribe and share with others, I think you help people just by sharing. And I'm glad that I'm doing this. And I hope that if anybody is in a situation with custody of a child, if you show them this video, and I just plead with you, please, what would you do? What would you do if your kid had cancer? Would you not give them the chemo to make you feel more powerful over your spouse? Would you if your kid had diabetes, would you feel more powerful if you didn't give them the insulin for the summer just to have power over your spouse? I'm begging you. On behalf of the patients, I'm begging you. If the medicine helps a child, let them have it. Decide to war have your battles in some other fashion. War with each other in some other fashion. But don't put your kids in the middle, and don't make their health the issue that is the leverage point between you and your warring spouse. I'm just asking you. So if you share this video with others, somebody sees this, if I just change one life and just help one person, it's worth it to me. Please, I'm asking you. If the kid needs a medicine, just let them have it. Fight about something else. Okay? All right, so that's all for today. I'm Dr. Dave Psychiatry. Thanks for coming to see me.